consortium of Liquor Traders Association of South Africa has just concluded a meeting with Eastern Cape Premier Oscar Mabuyane. Both have resolved to cooperate in the fight against alcohol abuse in the province as part of ongoing efforts to curb the spread of coronavirus infections. It's after the Premier made it clear that he's lobbying for alcohol to be banned in the province. We're joined now by Laking Timani. He's the convener of the Consortium for Liquor Traders Association of South Africa. Also part of the conversation is Eastern Cape Premier Oscar Mabuyane spokesperson Mabuyane. Let's begin perhaps with you, Lucky. You, of course, were representing many of the tavern owners and those who sell alcohol in the Eastern Cape to try and lobby the Premier to change his mind when it comes to this particular issue. What exactly did you put on the table?
Good evening, Kathy, and good evening to your viewers. Thank you for the opportunity once again, and greetings to Mabuyane. I appreciate his time and all that he has done for us today. We didn't actually lobby the Premier, suffice to support his effort to fight the scourge of alcohol abuse and harm in the province of the Eastern Cape. We support his call that people need to partake in alcohol responsibly. So ours was to support his stance on being tough on the abuse of liquor, which is actually the stance that we support as Liquor Traders Association. So the meeting went well, and we appreciate that. We made a call, we reached out to him lunchtime, and within 2 hours, his entire cabinet was sitting down with us, having this productive meeting, which resulted in us finding common ground. So we really appreciate, the great leadership shown by the Honorable Premier Oscar Mabuyane in this regard.
Mabuyane, the Premier was quite adamant when he made this call, because he's looking at the impact that the indirect effects of alcohol, the burden that it places in particular on the health system. So what has changed? What does this mean that the Premier no longer wants a ban?
Good afternoon, good evening to you, Casey, and viewers. And look, the Premier's statement has always been on banning for this period because of the abusive and reckless use of alcohol in terms of consumption. The Premier does not hate the alcohol industry. He supports the industry. He supports those that are complying with the regulations. The province has registered, licensed rather, about 7,500 liquor traders in the Eastern Cape, and those continue to trade within the regulations and the allowances of their permits. What the meeting did was to look at how government and the sector can work together to fight abuse in the province, because we believe the abuse of alcohol will make a lot of people to be vulnerable to infections of this virus. And the Premier feels that the meeting was a commitment by the sector to work with government to take heed the message that government has been putting out to fight abuse of alcohol. This is a strength to the work that is done by the multi-sectoral team in the province to say, for us to fight this virus, we need to work together. The Premier welcomes the intervention and the support that is made by these business people, because he feels that they are sacrificing profits and they're putting the lives of the people first as their priority.
So what exactly is that intervention going to entail? What has the industry promised to do in the Eastern Cape that they're not already doing, especially anywhere else in the country?
The meeting agreed to bring together both government and the liquor traders, subs, and our provincial liquor board to push a campaign that is focusing on discouraging abusive and wrong consumption of alcohol, to set a hotline which members of the public are going to use to tip off law enforcement about companies and people that are breaching the regulations of the lockdown, selling alcohol to individuals under the age limit, also those that are selling illicit products of liquor. And this is done to also bring the spotlight to those that are going to be, that in the province are hosting house parties, contrary to what the regulations are saying. So this is a teamwork that is focusing on ensuring that the sector complies with the regulations, so that when there is that working together, we will report any incident so that everyone consumes within the allowed regulations.
Lucky, of course, a part of your members had promised that they would abide by the lockdown regulations. And it seems the impression is that they actually haven't been doing that. To a large extent, you as a body were responsible for holding them to account and for ensuring that everybody is abiding by these regulations.
Kathy, I will not agree with your assessment that our members have not been abiding by the regulations. I'll even put it to you that our members have been abiding, and we have seen across the country, you know, the support that we've been receiving actually from other key stakeholders.
Sure. Perhaps let me just contextualize that. The MEC for Community Safety in the Western Cape told us just a little earlier in this bulletin that in fact it was especially shop owners, your shebeen and tavern owners, that were contributing to breaking the lockdown regulations, selling alcohol beyond the prescribed time limits. He says that's an issue that they're particularly facing a challenge with in the Western Cape.
Sure, Kathy. So we actually reached out to the Honorable MEC Albert Fritz this morning, who promised to come back to us, you know, to have a further engagement with him. We understand that there are some pockets of, you know, rogue elements within the shebeen space. And I need to clarify, shebeens are unlicensed outlets in themselves. So they are not licensed, and those are not our constituency. But we continue to work with government to ensure that, you know, no one deals in liquor, you know, outside of the permitted structure, which shebeens fall under. So, but we have reached out to the MEC to say, let's sit down and then see what better methods we can employ to make sure that, you know, in the Western Cape in particular, we come up with interventions that are going to support the health interventions that the government is trying to put in place there to ensure that we fight the scourge of COVID-19, as it were, and also the abuse of alcohol in the